Hello, my name is Emily Tuma and I live in Bend, Oregon. So I chose to interview a local veterinarian about equine parasites. I interviewed Dr. Wayne Smotzer at Bend Equine Medical Center. I interviewed Dr. Smotzer because we have used him as our equine veterinarian for over 15 years, and he has always been very knowledgeable and great with our horses. And a little bit about Dr. Smotzer. In 1982, he joined the faculty at Oregon State University as an instructor in veterinary medicine. He was a clinical surgeon at OSU, and he developed a lot of other services and was part of many scientific publications. He is now a founder and co-owner of Bend Equine Medical Center here in Bend, and he practices as a specialist in lameness, joint disease, angular limb deformities, and colic, as well as surgeries. He continues his special interest in equine ophthalmology, and active research continues in laser surgery, colic surgery, and innovative surgical techniques. I asked Dr. Smotzer what some of the most common parasites in horses that he sees are, and the first one that he listed off was ascarids, which are known as roundworms. And as we know from class, they are host specific. The most common one that we see in horses is called Parascaris equorum. The female ascarid in a prolific egg layer produces hundreds of thousands of eggs per day, and they all have the thick, multi-layered shell that makes them resistant to desiccation and freezing, which is why we see them in horses as a common problem. And you can see the life cycle of these ascarids. An easy way to treat and diagnose these are to observe in the manure of infected horses, especially after you've treated them with an effective drug. Transmission is usually via ingestion of infected legs, usually while grazing. And once they become infected, equine ascarid eggs may remain viable in the pasture for a decade or longer, so it can be a really big concern to horse owners. The BZD group of drugs is currently represented by those following drugs, and they are pretty effective against the roundworms. The ascarid eggs can be found in any environment occupied by foals, weanlings, or yearling horses, and P. equorum is one of the few equine parasites that can be transmitted in stalls. Because the infected eggs remain viable for a decade or longer, inadequate control can have chronic consequences. So the manure of young horses should be picked up frequently and disposed of, and bedding should be stripped regularly. The second parasite that Dr. Smotzer discussed with me is another one that we are common with, the bloodworm, the large strongyles. The three major species are here listed that we find in horses. And we know that the larvae develop to the infective stage within 1 to 2 weeks after the eggs are passed. Infection is by ingestion of infective larvae, which go from the intestine and then migrate before developing to maturity in the large intestine. And the repatent period is usually 6 to 11 months. Adult large strongyles are active blood feeders. They ingest mucosal plugs as they move about in the intestine. As a result, anemia, weakness, and diarrhea are common symptoms. S. vulgaris is important because of the damage it does to the cranial mesenteric artery and its branches. Because of the damage that it does, we often see colic, and the diagnosis is usually based on finding of eggs in the feces, and it's usually this bright colored here. Colic due to arterial lesions has been successfully controlled by anthelemic treatments. Ivermectin and moxidectin at standard dosages are effective against the larval stages L4 and L5 of S. vulgaris. Parenteral tetrate used for prevention is also helpful. Findibenzonal and oxyfendazole at dosages higher than that for adult parasites are also effective against larval infections. Daily administration of parenteral tetrate effectively prevents establishment of arterial stages of S. vulgaris. The ivermectin treatment has eliminated large strongyle infections from closed herds. Along with the large strong eyles, the small strong eyles are also common parasites in horses, but unlike the large strong eyles, small strong eyles do not migrate extraintestinally because early development is confined to the wall of the intestine. Third-stage larvae may progress to the fourth stage without interruption, or they may undergo hyposis and resume development only after prolonged periods of dormancy or hyposis. When the L4 emerge from the gut wall, they feed superficially on the mucus and may rupture capillaries, but are less pathogenic than the large strong eyles, and they molt to the adult stage. The diagnosis of small strong eyles is an acute syndrome of sudden weight loss, often with severe diarrhea, and is seen in temperate areas in late winter and spring, particularly in young horses and ponies younger than 5 years old. This is associated with the large emergence of the hippobiotic larvae from the intestinal wall as L4. Although of relatively low incidence, larval cythotomisis is nevertheless of concern because response to treatment is variable and prognosis must be guarded even with intensive therapy. It can be difficult to see the strong eyle eggs in a fecal examination, Dr. Smaltzer said. So in order to see the growth observation of the L4 L5 larvae, they're usually bright red and you can see them in the feces, and it can be helpful in making a diagnosis. Or biopsy of the large intestine via laparotomy also may assist in diagnosis because the rectal biopsy is less reliable. Treatment for small strong eyles and adult Pseudothymosins are easily removed from the gut lumen by a wide range of anthelmintics, provided that the worm population is susceptible to the chosen drug and resistance hasn't formed in that population. Benzimidine-resistant strains of small strong eyles are common in some regions and need to be watched and controlled. An effective drug should reduce the egg count to 0 or to very low levels. If resistance is present, a different class must be used because side resistance occurs within these groups. Small strong eyle larvae in the intestinal mucosa are much more difficult to effectively remove with these drugs. Ivermectin has been used, but it's given mixed results. Treatment with large doses of fenobenzol or myodoxin has been reported as effective and can be used during the winter to reduce the risk of larval cyathomosis. But horses already suffering from this class of this disease may not respond to treatment if submucosal inflammation is too severe. So consequently, treatment must be also aided with other steroids and other appropriate supportive therapy at this time. Prevention can be as simple as routine or interval treatments, and they're traditionally used and intended to minimize the level of pasture contamination, which thereby reduces the risk associated with the accumulation of mucosal larvae and adult worms. Removal of manure from paddocks and pasture helps control and may also help reduce the number of treatments required. And veterinarians will stress that administering the anthelmintic is important, that all horses should receive the proper dose as determined by body weight or accurate estimation. And it is also sometimes useful to rotate the different classes of drugs used, and you can either do it in a fast rotation, which could be monthly, or slow rotation, which is annual, and it's usually practiced to prevent development of resistant and parasite strains. And also, fecal samples should be examined periodically to monitor the effectiveness of the program in the presence of drug resistance. Overall, Dr. Smaltzer says that management against these parasites are okay because, as we've seen, drug resistance is seen and must be monitored. Dr. Smaltzer points out that it is best to kill in the larval stages, which is why ivermectin is a treatment of choice. Another disease that Dr. Smaltzer brought up when I interviewed him is EPM, equine protozoal myeloencephalus. Most cases of EPM are caused by an epicomplexan protozoan, and horses are infected by the ingestion of the sporocytes in contaminated feed or water. The definitive host for S. neurano in the U.S. is the opossum. Possums are infected by eating sugars containing muscle tissue from an infective immediate host, and after a pre-patent period, about 2 to 4 weeks, infectious sporocytes are passed in the feces. Armadillos, skunks, raccoons, sea otters, seals, and domestic cats have all been known to be intermediate hosts. Dr. Smatser stresses and states that this disease, EPM, can be difficult to diagnose because it presents as lameness. Furthermore, there is no known proven preventative measure for this parasite other than the obvious control of host and modes of transmission. Dr. Smatser at Bent Equine Medical Center was a great reference, and I learned a lot from interviewing him. Furthermore, I use these references for alternative information and images that you have seen on the slides. And thank you for watching my interview with Dr. Smatser.